What if I told you that deadlifts are bad for your back? That you should always keep a neutral spine? That if your back hurts, you should rest, ice, and be sedentary until you're 100% again? And if your MRI shows a herniation, then you're absolutely screwed. What if I told you that, Ryan? What would you say to that? Huh?
I'd call you on your BS, bro. I'd tell you
Hell
to
yeah.
shut up.
Shut up, man. Just shut up. You would record one of those videos where you have me, like you're looking at a phone, and then it's the
Yeah.
video of me saying those things, and then
Yeah.
the video plays, and then you're like, this idiot, like,
Yeah, dude, and
whoa.
it's like just my business partner, and I'm
Yeah.
and you're like,
Yeah.
dude, what are you doing?
It's like, man, you got to stop with those. Like,
Start some drama, dude, within the business,
yeah, that would be a good way to get engagement.
or just confuse, or it might be terrible.
Yeah. Oh, it usually goes it usually goes two ways when it comes to a social media post. It
Oh, hit
either
or miss.
works, yeah, it either works great or it's the worst thing ever. But those are all actually myths. If you're listening and you're like, "What's so funny?" Well, all those things are actually myths and common misunderstandings when it comes to lower back pain. And today, our episode is all about the lower back. Specifically speaking, we're going to teach you how to life-proof your lower back for life. Um, and you may be asking yourself, what does life-proofing even mean? Life-proofing, it's a term that I kind of came up with. Basically, getting your joints to a place where it can meet the demands of life. So no matter what life throws at you, your lower back's going to be fine. And if it does get injured, you're still able to move, be active, and do the things that you love to do. So that's what life-proofing means. Some examples, when you're in your 30s, sometimes you just wake up and you turn the wrong way and you throw out your back. Well, if you life-proofed your back previously, that throwing out of the back wouldn't have been as bad. When you're older, when you're in your 40s and you're playing with your kids and you're kneeling down to pick them up, there's less of a chance for you to throw out your back. We're not saying that, we're bringing down the probability to zero, because that's impossible, but we're going to get your back to a great place through this podcast, and it's gonna be pretty thorough. And the reason we want to dive into this is because I think the statistic is like 70% of Americans will and have experienced lower back pain at some time in their life, and that's because of our sedentary culture. Most folks don't know how to train and move and live to make sure that their back doesn't hurt. And lastly, it's that fear of injury, right? So a lot of people get injured, and instead of moving and staying consistent, they just unfortunately are advised to be sedentary. And being sedentary actually makes things a lot worse. So today we're just gonna talk about ways and methods, anywhere from training to nutrition to recovery to habits to your lifestyle, that'll help you life-proof your back for life. I like saying that. I don't know why.
For life.
Um, for life. But let's start with some personals. Some personals. Have you ever fucked up your back there, Ryan? Your lower back.
Yeah, yeah, yeah. I've had back pain for sure.
Nice.
Um, One of the times I just like it was actually in the gym. Like I deadlifted like wrong or too much weight or something, or I didn't warm up. This was in like like early 2020 or 2019 or something. But I knew instantly. Like when you throw out your back, you know instantly, right?
Yeah.
Especially if you've done it a few times, you're like, oh man, like that's gonna suck. Like that's gonna take 2 weeks, you know what I mean? Or like that's gonna take a week for me to feel better. But
Yeah.
this particular time, dude, it was kind of scary. I don't know if I've ever told you this, but like, so that happened. Like I threw out my back. I go to bed that night. So later that night, I'm in kind of pain, nothing like crazy, but I could tell like my back was out. I'm going to bed. As I'm trying to go to bed, to this day it was so weird, and I'm sure it was related to the back pain. So what happened was I'm in bed, I'm trying to go to bed. dude, all of a sudden my leg starts like shaking, like convulsing, like big
Oh,
convulsions, like
wow.
like shaking. And I'm like, whoa, like what is going on? Like it was involuntary. And then it went away for like 30 seconds, and then it would come back like it would go away 30 seconds, and that like went on. And I was like, am I gonna have to go to the hospital? Like, what is going on? Eventually, it did go away, and I was able to like fall asleep. But I was that was scary. That one was scary.
Damn, that's crazy. Yeah, I don't know. You've never told me about that.
Yeah,
Um,
it was gnarly. It was scary.
did you do anything to make it to help it heal, or you just kind of just chilled off of on it?
I did the normal thing. Like we're gonna talk about methods and all that stuff. We'll talk. We'll get into it. We'll get into it. If that happens, like if my back goes out, like I have the tools in the toolbox to like get back into lifting and stuff. One of them is
Nice.
mindset. I want to just plug that right now. One of them is mindset because a lot of the times people are like, "Crap! Like I did something
Yeah.
wrong. This is terrible. Like here go here goes all my progress and stuff like that." And if I do ever get like a tweaked back or something like that, like these days, my mindset is like, "Dude, this too shall pass. This is fine. I can do other things. I can do I can do similar lifts that are not gonna like load my spine and stuff like that." So I will say through the process of like screwing up my back, mindset is huge. It's a huge one. Positive
Absolutely.
mindset. It's a
Yeah.
big one.
A lot of people don't even consider that to be part of the rehab process or the healing process is just starting with your mindset and saying, yeah, I'm injured right now, but that doesn't mean that I'm going to abandon all hope. And I'm not going to think that I'm broken. Instead, I'm going to be like, hey, I'm just going to modify some movements, and I'm going to believe that my body will heal because it has healed, and that's the function of the human body is to heal itself, right? So just having that mindset is going to improve your mental health. It's going to get you moving, and it's going to facilitate healing, like at a really high level. So yeah, we're definitely going to touch on that. And in my, I'm fortunate enough to where I haven't had like I actually, I mean, I got to knock on wood here, but
I'll do
I don't
sure.
think I've technically thrown out my back. I've had like a dull and achy pain and some sciatica stuff in the past. Primarily the biggest thing, or the injury that really stands out was when I first started personal training. I was doing about maybe like 30 to 40 hour long sessions a week. And basically what that amounts to is about 30 to 40 hours of like physically hard labor, right? Because you're moving weights and you're loading up deadlift bars and barbells and showing people how to squat, and you're doing that for 40 hours a week, which is it's a lot. And in addition to that, I was also training myself. So eventually my back just couldn't take it, and at that time I was a new trainer, so I didn't really understand like I mean, I knew some stuff about prehab, but it was more so rehab stuff because I was also working as a physical therapy aide. So I knew how to like rehab it once the injury happens, but none of the stuff to prevent it or mitigate it, right? None of the strengthening stuff, or even I wasn't really even doing mobility. So yeah, it got really bad, and it was just like very dull and achy. I could feel it all the time. My hamstrings were super tight. I went to a physical therapist. Unfortunately, they actually made it worse. And I think what I ended
Damn.
up doing was for like a couple weeks, I just told my clients to move their own weights, and I that's actually when I started reading the Back Mechanic book by Stuart McGill. Have you read that one?
I don't think I have, but Stuart McGill, he's the man.
Yeah, he's like one of the he's like a physiotherapist professor from Canada, and he's done a lot of research on back pain. Um, he's kind of a little bit of a polarizing I wouldn't say polarizing, but there are definitely some people who are like F Stuart McGill, like because
The McGill 3 or whatever.
yeah, and there's reason to say that, like the people that are just like so evidence-based and they're just like really deep
Mhm.
in the literature where it's like, okay, these statements aren't necessarily true. It's like, yeah, you have a valid point, but also he's helped a ton of people, and there's a reason why it's, the three exercises that he prescribed help so much, right? So basically, I read the book. It was a really good education for me, and it kind of got me deep into the rabbit hole of just prehab stuff and Lifeproof and stuff. Basically, what I did was actually I'm just gonna segue into the foundation of life proofing, because then we can talk about like some of the stuff that we did anyway. So we're gonna hold off on that. Anyways, when we talk about life proofing the lower back for life, you can you can think about it as, let's say, life proofing the lower back is like the roof, and then you have some pillars that are the foundation of it, right? So those pillars or the foundation are mobility, strength, your habit slash mindset, nutrition, and recovery. So there's a lot of things that go into it. It's not just exercises, or it's not just mobility. It's a lot of things that basically are a accumulation of this like holistic routine to help mitigate and prevent lower back injuries. So let's start with our favorite, or basically the one thing that everyone talks about when it comes to lower back pain. So we're just like movement and exercise and mobility. So specifically when it comes to mobility, we want to start with just the spine itself. So like the lowest hanging fruit when it comes to preventing your lower back pain or your lower back pain getting injured is having a spine that can move really well. So that means that your spine can flex, it can extend, open up, it can laterally flex, like bend to the side, and it can rotate. So that's the first thing we want to work on. And a lot of people are really good at flexing their spine because we're bent and we're sit over on the chair all day, but extension is really hard for them, and then rotation and that lateral flexion is super hard. So there's a lot of great exercises for you to get there. Obviously, like the podcast format is not a great place to talk about specifics when it comes to exercise, but for example, like everyone knows the cat-cow, and actually last week I trademarked a new exercise called the Persian cat-cow, where you do flexion and extension and then you do the rotation. So that's my exercise. Every time you do it, you pay me 1 cent. So that's a great warm-up, and then just other stuff like the elevated lat stretch is really good. Doing like a couch stretch with like a lateral flexion, or the open books. I do that every morning. In addition to how well your spine moves, your hip, your pelvis also needs to move well. You almost want to think about the lower back, the pelvis, and the hips are kind of like this one interconnected movement, right? So if your hips don't move well, like if you can't bring your legs up or take them behind you or rotate your hips, guess what is going to take up the work or the brunt of the force when you squat, lunge, run? That joint is going to be your lower back. So if your hips don't move well, or you don't have mobility in your hips, then your lower back is going to take on a lot of force, and eventually it's not going to be able to handle the force, and some sort of injury will inevitably happen. So good hip mobility is super, super crucial. In fact, a study conducted in 2015 in the Journal of Sports Physical Therapy found that folks with lower back pain had significantly reduced passive hip extension. So passive hip extension is when someone takes your hip and kind of moves it behind you, and on average they had 10 degrees less compared to healthy control. That means they basically couldn't move their hips as well, and so when you can't extend your hip as well, your spine will take on more of a strain during activities like walking, standing, and lifting. So the tighter the hips, the higher the chance of injury to your lower back. So couch stretch, if you're only going to do one stretch to mitigate lower back stuff and improve your hip mobility, it's the couch stretch. Like that's my favorite one, and that's literally moving your hip into extension. So do that for at least a minute every day. And when it comes to kind of like setting up habits or figuring out a way to fit mobility into your life, and I know like a lot of people have issues with that where they just like to do the strength training, just do some mobility stuff at the start of your workout. Set aside like 5 to 15 minutes, do some cat-cows, Persian cat-cows, some hip swivels, and then at the end of the workout, just do a static stretch of your couch stretch, open books, things like that for a minute. What I also like to do is you can habit pair, right? So every morning, what I do to kind of get my stretching out of the way, because sometimes I don't even like to stretch after my workouts, I just want to get it out of the way, is I will pair reading, coffee drinking, and stretching. So I have a timer on my watch. I set it to 1 minute. I'm reading. Once the timer goes, I'm done. I switch to the next stretch or move to the other side, and that's been super super effective for me. Not only does it wake me up, but I get my stretching out of the way super early. So I can't stress the importance enough of that mobility. A lot of times when we have online coaching clients or personal training clients, when they come in and they're like, oh yeah, anytime I deadlift, I only feel it in my lower back. Well, that's because your hips aren't moving at all. Or anytime I squat, it's in my lower back. Well, yeah, same thing. Like your hips aren't moving, so then your lower back's going to feel most of it. And a lot of times just loosening things up helps wonders, especially if you haven't gotten to a point where, it's a pretty significant acute injury. If you just have some dull pain, just start with that mobility. And as always, we have a ton of mobility resources and content out there, even for free. So on the Instagram, TikTok page, and then on the YouTube, there's like follow along stuff. 30-day free trial on our app if you want to try some mobility routines too. But anyways, let's move on to strength and stability. So Ryan, I know that that's kind of part of your rehab process. So tell us about why strength and stability is important for the life proofing process.
Yeah, so Milad just went over like half the battle there, the like stretching and the mobility part of it. I'd say like that's half the battle. And the other half the battle, well, when it comes to like moving and exercise and stuff, the other half is like strengthening certain muscles, supporting the lower back. So you have mobility. Milad went over that, and now we're gonna go into like strength. Okay. Strength training. Okay, so your core is fundamental when it comes to protecting your lower back. And so some core exercises to think about. So we have anti-rotation. So anti-rotation, think of like a pull-off press. If you don't know what that is, you can look it up. A pull-off press is an anti-rotation exercise. We have anti-lateral flexion work. So an example would be like a side plank. So lateral flexion meaning like side to side. So like a side plank, or what is it? A suitcase carry, where you're like holding a dumbbell and like walking in a straight line. That's like your body, the gravity wants to pull you into lateral flexion, but you're doing anti that. And so those are some exercises that are going to help strengthen your core. So core strengthening, very important piece of the puzzle when it comes to mitigating lower back pain. I have our podcast notes in front of me, and we have a study that says, so a clinical study on patients with chronic low back pain found that core strengthening exercises combined with lumbar flexibility and glute strengthening led to significant improvements in both pain levels and functional capacity, regardless of how long the patient had been dealing with pain. So core strengthening, very important. Lumbar flexibility, glute strengthening. So some key takeaways there. Core strengthening or core training isn't just about preventing injury. It's a cornerstone of recovery too. Okay, let's continue with the core exposure training. This is when I was a new trainer, I wanted to like, it's back when, what year was that? Like 2015-ish. Like when you think of core training, you don't think of sit-ups. You think of like planks or like dead bugs and stuff like that. And so I was like kind of like anti sit-ups, but I've since learned that there's nothing wrong with sit-ups. They're actually like pretty good for you. So sit-ups is a good exercise for your core and preventing low back pain. We have Jefferson curls. You can look that one up. That's a very good one. These are very important and very useful. So strengthen your core. That's the first part of like this whole strengthening part of preventing low back pain. Then we have posterior chain. So posterior chain, think of like your hamstrings, your glutes, even like low back itself. So you can do exercises like RDLs, Romanian deadlifts, bridges or hip thrusts. That's directly going to strengthen your glutes, and things like a split squat. So we went over core training. That's important. Glutes, I feel like, is another like really important muscle group to work and to build up if you're experiencing low back pain, or if you want to prevent some low back pain. Glute strengthening, really, really important there. And then you can do direct lower back strengthening exercises. So things like good mornings, where you put the bar on your upper back like you would do a split squat, and basically do like an RDL, but the bar is on your back. So that would be an example of a barbell loaded good mornings. There's also like seated good mornings you can do on a bench, holding a dumbbell, and doing kind of like an RDL. That's a seated good morning. Those are good for directly strengthening your lower back and your glutes too. The Jefferson curls, that one's kind of an interesting one. You basically like round your spine, and you basically are doing like a deadlift or an RDL, but you're bending your spine. So you're directly working your lower back. On those ones, you're not going to load it up like a real like RDL. Like you're not going to go super, super heavy, especially if it's your first time doing it. You can just do like body weight too, for example. Do you usually when you start someone with Jefferson curls, Milad, do you just do like body weight, or do you do super light, or what do you do? What's your
always body weight to start.
Yeah.
And then once like the pain is non-existent, especially in flexion, then you slowly start to load it up, like 5 pounds at a time, holding at the bottom, moving up. There are some people on social media that do like super heavy weights, like they're doing like 135, but that's honestly like that's unnecessary and potentially dangerous. Because
it's like done it and like
and like what's the point of that, right? Like there's a lot better ways to load up your spine, and because at the end, once you're getting to 135 territory, you're doing like strength and hypertrophy training, right? There's a lot better ways to do that without putting your joints in end range. It's good to get there and practice that, but you don't have to go super hard. But speaking of progression, one big thing to highlight, right? A lot of people will start with planks and dead bugs and glute stuff, and they'll start the rehab process and they'll feel better, right? Maybe they'll get to like 70%, but the pain kind of persists and it kind of plateaus for a bit. So one thing to really consider is once you can do a plank for 60 seconds without lower back pain, then it's time to load up your plank. Or if you can do your side plank for 45 seconds, load up your side plank, add a Copenhagen plank. Basically, you're always trying to progress. And that's why we even say like sit-ups are super important, because you can really load up your sit-ups after a while or do them from different angles. So the biggest thing here, in the same way that you do progressive overload, or you make things a little bit harder when you're trying to build muscle and strength, you do that for the prehab stuff and the rehab stuff. So once you're feeling a little bit better, make it harder. It shouldn't be like a 9 out of 10 hard, but it should be harder, like you're feeling maybe a little bit sore the next day, or you're feeling challenged. So that's the biggest thing. And same with your mobility, right? These things don't happen in a vacuum. Sometimes people will stretch for a minute for 12 weeks doing their couch stretch. That's great. But then eventually that minute's not going to be enough to actually feel a stretch. So then you have to do a couch stretch against the wall for a minute. And then you have to do a couch stretch against the wall for 90 seconds. And then you have to do it for 2 minutes. And then you have to work on your splits, things like that. So there's always like a progression there. Obviously with it depends how far you want to take it, right? Like if you're trying to get your front splits, not everyone needs to get their front splits, but if you're trying to do that, you have to keep progressing. And then going into habits and daily movement. So these are the things that we're doing outside of the gym, that are just part of your life, part of your routine. And the biggest bang for your buck here is, believe it or not, it's actually walking. Like it's super crucial. I know walking is like, we always talk about it for fat loss and NEAT and things like that, but for like getting your lower back pain managed and staying active, walking is great, but also keeping your lower back healthy, your vertebrae healthy, and building resilience. It's also a great way to do that too. So basically, walking will rehydrate your spinal disc through compression and decompression and build up that blood flow. It also will slightly activate your deep core and glute muscles, which we talked about in our previous section, and just overall improves posture, circulation, and your mental health. That's a big one too. And again, pain is this kind of abstract thing, right? Pain are just signals from the body. Sometimes you will feel pain without there being some structural issue in your body, and that's because of your nervous system and your emotions and your psychology. So getting out on a nice walk when there's sun, when things are feeling good, is going to improve your mental health, and it's going to basically affect your pain perception and bring down your pain levels. Lots of great research on walking. Believe it or not, like there's definitely research on the mobility and strength stuff, but like there's meta-analyses where they take a bunch of, oh my God, my hamstrings cramping. Here we go. We're good.
You're like, my back's going out.
Yeah. So there's meta-analyses, like really solid studies where they basically do like a statistical analysis of like a bunch of different studies, and then they create a conclusion from that. So a new study published in 2024 in the Lancet found that people who walk regularly after recovering from a lower back injury went nearly twice as long without experiencing experiencing a reoccurrence of pain compared to those who didn't follow a walking routine. And their program was pretty chill, pretty simple. Basically, they walked 30 minutes a day, 5 times a week. And it was sort of customized to the person's age, body type, fitness level, and schedule. But basically, the number one important thing, and this is something we'll go back to with the myths, but even in the study, when the participants had pain, they were still encouraged to walk. Just adjust the intensity as needed. Basically, what that means is even if you're in pain, you should still be walking. Maybe you walk 1,000 or 2,000 steps less, but even if you're in pain, walk and you're going to feel better. It's going to help you. And I have a lot of clients that have started out just walking, doing mobility exercises and core exercises, and after 8 weeks of that, they're ready to lift weights again. Even my dad, that's like where I'm helping him with his sciatica right now, and that's something that really helps him is like even jogging, hiking, elliptical is super helpful in just decreasing that sciatica pain because it improves blood flow, improves mental health, posture, all that stuff. So it's great. It's free. It's accessible. And
That's what
and
my
you can
dad
do
did
it.
too. After
Do it
after
anywhere.
he got his back surgery, that was like his part of his like rehab program, was just go on walks. And I remember I would help him, or I wouldn't. I would go on walks with him around the school, and it like really really helped his recovery. Um, yeah, just that's a good memory. But yeah, walking, super important.
Yeah. And you could do it with your family. Like there's a communal
Hmm.
aspect of it. It's awesome. Another thing in terms of like habits and routines, specifically a lot of like clients or people in consultations or in the comments ask me, it's like, okay, like what's the best posture for preventing lower back pain or to not get lower back pain? Honestly, there's no such thing as the best posture. The best posture is a dynamic posture. So just keep moving throughout the day. So if you have a lot of pain or your back tends to get super tight, every 25 minutes, just change your posture. So go from sitting to standing. Set a timer for 25 minutes, then go from standing to laying down, and just keep cycling through. Eventually, it's going to get better, and then that dynamic change maybe moves to every hour. So again, no such thing as perfect posture. The best posture is a dynamic one. And the biggest thing when it comes to habits, routines, is to just keep it moving, man. Just keep it frickin' moving. When you got pain, or if you want to prevent pain in the future, move. Literally, that's the high level answer to every fucking thing is just move your body. So the more you
Movement is
move,
medicine.
movement is medicine. The more you move, the better you feel. It even makes your sleep better. You heal better. You get stronger. It's the best thing ever. Um, and I touched on this before, right? I know a lot of people don't have too much time for this stuff, especially like the mobility and the core training. Just schedule it in bite-sized chunks. So just 5 minutes. So in the morning, you do it for 5 minutes. You just do that's like 2 to 3 stretches, and then you have another 5 minutes in the midday, and then you do your planks. So do your 60 seconds of planks, side planks, bird dogs, and then you have another 5 minutes. That's 50 minutes total. At the end of the day, you do a little graded exposure stuff. So maybe you do some extensions on the ground, you do some Jefferson curls, you do some kind of rotations, things like that. You don't have to do it all in one go. Just do 5 minute chunks at a time. Is super, super helpful. And yeah, in addition to that, the other thing that's in your control in this whole process is the things that you put into your body and how you rest. Um, and did you have any, did you think about that, Ryan, when you were kind of uh, rehabbing your thrown back? Like, what was your approach to nutrition and recovery during that time?
Well, it's definitely a piece of the puzzle for sure. The way because we're going to talk about nutrition and how that's actually important to your lower back. And the way I actually think about nutrition and how it's related to pain and like pain management is that, well, first I think of what poor nutrition is. Poor nutrition, the way I have been looking at it is like it's a stressor on your body. When your body is really stressed, when your system is really stressed, you are more likely to you're more susceptible to injury or low back pain. I've seen it in clients when they're like super stressed or they're getting really crappy sleep. You're more likely to like throw out your back. And what we're going to talk about now is poor nutrition or how you can improve your nutrition and why we're even talking about it in the first place. If you have poor nutrition, your body is in an inflamed state, which is not good for recovering if you just got injured, or it's not. You're more likely to get injured if your body is really inflamed, if you're eating poorly. Does that make sense?
Yeah, yeah. I mean, it makes sense. Again, it's all connected, and I've definitely felt. I think with sleep is the biggest thing. If I don't get good sleep, the likelihood of an injury goes up
Mm-hmm.
like by a ton. And that's happened to me before, not with my lower back, but more so with my ankles and my knees and my shoulders. Those are kind of my problem areas. So anytime I get horrible sleep and then I go all out on a run or at the
Mm-hmm.
gym, I'm pretty achy the next day, or that's like the catalyst to my injury. And yeah, I mean that's like it's literally the less you sleep, the more inflammation in your body, the more issues or injuries and tissue degradation you get in your muscles, ligaments, discs, all that stuff. And
It's
yeah, this
it's
this all
it's just sorry. It's just how I connect poor nutrition to it too. I feel like it's like a stressor on your body. Like if you're eating like crap,
yeah.
it's like it's your body's inflamed. Like you're more likely to be inflamed, and that's gonna you're more likely to screw up your back. So um, yeah, nutrition important. So what I want to talk about is some ways to clean up your diet or some foods that will fight inflammation. So first, we have fruits and vegetables. So berries like blueberries, strawberries, raspberries, they're very rich in antioxidants that can actually lower the inflammation. We have leafy greens like spinach, kale, collard greens. They are full of vitamins and minerals. Broccoli, also very anti-inflammatory and can support that spinal health. Next, we have healthy fats. So we have fatty fish like salmon or sardines. Do you like sardines?
I do actually, yeah. Like I like the bougie sardines. You go to like a wine bar and they have canned sardines they give you with the wine. It's really good.
I like them in a Caesar. I could do like a Caesar
Oh
salad
yeah.
with sardines. But what about on pizza? Have you ever had that?
No, no.
Don't try it.
Anchovies.
Oh,
I
that's
had
what I'm thinking of.
anchovies. Yeah,
Am I
yeah.
thinking of anchovies or sardines? I'm thinking of anchovies.
Yeah,
Anyways,
anchovies, yeah.
so so we're talking about healthy fats. Fatty fish, they're loaded with omega threes, which is a
Omega.
natural
Omega.
natural inflammation fighter. We have nuts like almonds and walnuts, seeds like chia seeds, flax seeds. They are full of healthy fats, protein, and fiber, which I've recently been putting chia seeds in my Greek yogurt, which is a game changer. Like I've been
Yeah.
tracking my calories and a lot of stuff, and I see that it's just packed with fiber. It's like so good for
Dude,
you.
chia,
So
chia seeds are they're very fibrous. Like
yes,
I think one serving size of chia seeds is 33% of your daily fiber.
yeah, insane,
Yeah. Yeah,
insane.
it's great. Freaking regular off that.
Yeah. We have olive oil. So we're talking about healthy fats still. We have olive oil, really good alternative to processed oils. And next we have whole grains. So oats, quinoa, brown rice. They all support your gut health and can reduce systematic inflammation through their high fiber content as well. So speaking of fiber,
Buy better. Yeah. I even
fiber.
with like the berries thing is so interesting. Like anytime I have like organic, fresh strawberries and blueberries and raspberries and blackberries, I just feel like healthy. You know, I feel
Hmm.
like cleansed.
Yeah,
So
I've been
yeah,
putting
and
frozen berries also into my Greek yogurt. This Greek
oh
yogurt
nice.
bowl is just packed with health.
That's in the morning
But
you
yeah,
do
I know
that?
what you mean. Huh? No, just for like
Snacks?
yeah, just a snack, just like a midday snack. Well, what I'll do is I have Greek yogurt. I put in some protein powder, so it's just packed with protein. And then I do the
Yeah.
chia seeds. I do the frozen berries, and then I'll do some peanut butter. So I love peanut
Nice.
butter. Love my peanut butter.
Sounds good, dude. That's a good bowl.
Okay, so those are the foods that can help fight inflammation. Next, what will be beneficial is um, getting some foods in your diet that is directly going to support your spinal health. So things like calcium-rich foods, foods that have vitamin D, and then some protein. So calcium-rich foods, think of dairy and greens like broccoli and kale. Those can help support your bones and help build strong bones and keep your bones nice and strong, including your vertebra. Vitamin D, that can help your body absorb and utilize the calcium. And you can get some vitamin D in your diet by adding that fatty fish, so that salmon or tuna, or fortified foods like cereal and milk. And then protein. We love protein. Protein is so beneficial, and one of them is repairing your muscles and the connective tissues. So think of, you guys know some good sources: chicken, turkey, legumes, beans, lentils, and chickpeas. And then, so speaking of diet, we usually say in our coaching, it's a good idea to eat a variety. So you can get a bunch of different benefits. So eat a variety of whole foods. Don't rely just on like one thing. Stay hydrated. So drink your water. Drink your water. So dehydration can stiffen the tissues and affect your disc health. So drink your water. Oh, cheers, Milad. Cheers.
Yeah. Water.
And then, like how I started out this topic, is just limit the ultra processed foods, the added sugars. Those can lead to an increase of inflammation and can just screw everything up. You know what I mean? We don't want that.
Yeah. And alcohol. Did we say that? No, I don't think we did.
But you just did, brother. Because that's also going
Alcohol.
to dehydrate you. It's going to screw up your sleep.
Fuck with your
It's
blood
going to make
pressure.
you do like backflips when you're not supposed to be doing that and screw up your back. You know what I
Yeah,
mean?
yeah.
So just be careful out
Indirect
there.
and direct ways of messing up your lower back is alcohol. So yeah, when you're going through a healing process, it's wise to cut down on the alcohol or just don't drink it at all. It's poison, right? So it's very counterintuitive.
Toxin.
Um, yeah, and speaking of injury, so injuries are, there's three things certain in life, right? There's death, there's taxes, and then there's you're gonna get injured. Um, this is funny because I also said that's what I said in the speech that I gave at your wedding. But
Damn, I don't even remember that part.
instead of injury it was like check-in call from Ryan.
Oh, nice. Nice.
Yeah.
So you said
Uh,
death, taxes, and a check-in call?
yeah, yeah, yeah,
Hell yeah, dude.
yeah. Anyway, so death, taxes, and injuries in this context. So you're
Hmm.
gonna get injured no matter what. Like it's just gonna happen. What you have control over, sort of, is how intense or how high of a grade that injury is gonna be, right? So when you do the mobility work and the core work and the strengthening stuff and you're eating healthy and you're practicing a healthy mindset, when you get injured, the intensity of the injury is just going to be a little bit lower than if you weren't doing those things. And when it comes to getting injured, it's okay, it happens. So let's say you do throw out your back, right? What's the first thing you want to do? Just focus on gentle movements, right? So typically when it comes to the lower back, you don't really want to rest, because what that's going to do is just going to stiffen up the tissues around the area, and your body wants to protect the injured tissue. So it's really going to kind of expedite that stiffening of the hips and the lower back and the weakening of certain muscles. And it's just going to make it harder and harder to get back to an active lifestyle. So if you can, just gently move, just even just like laying on your back and like twisting back and forth, or hugging your knees to your chest, or extending your back. Or, like we said, walking, right? In that study of like thousands of people, even when they had a flare up of back pain, they were still advised to walk. So go ahead and walk, do some cat cows, pelvic tilts. The big thing here is just, remember we talked about mindset, is just don't freak out. Don't label yourself in your head as broken. You're not broken. Your body will heal, and it's just part of the process. Think of it as a way of just learning about yourself, right? Your spine is robust and you're not permanently damaged. Once you're starting to feel a little bit better, like let's say the pain is down to anywhere between a 5 or a 6 or a 7 at times, it's time to kind of get moving with certain specific exercises that are a little bit more isolating of the back than walking, right? So start with some isometric. So basically an isometric is when you hold a muscle contraction without the muscles moving, right? So what that looks like is a plank. So start with just like a 10-second plank, and then go into a side plank. Do a dead bug hold. Just start there. Ramp your way up to 3 sets of 45 seconds per day. Once that's starting to feel good, add in some bridges. Lay on your back, bring your hips up. 3 sets of 10. Do some bird dogs, cat cows, and then eventually, this is for most folks around like the 4 to 8 week mark. You want to start getting back into the things that you were doing before in the gym, right? So if you're regularly strength training, go back into doing some Romanian deadlifts at a lower weight, right? We want to train our nervous system to be okay with doing things that scare it, right? And it is scary, but just start super light. Maybe even literally doing body weight squats and Romanian deadlifts or carries is going to help. And then once you build the confidence, just build up the weight again. That's the biggest thing. Now, this is all with a caveat where, like, if you have really intense numbness or a loss of bowel or bladder control, there is probably like a bigger issue. Or if you've done all these things and you still have that lower back pain, it could be an issue with the kidneys or some internal organs. So be sure to, go to your doctor or urgent care, things right like that. But other than that, it is scary to move with lower back pain, but moving is super, super crucial. Like it's just a non-negotiable. I think what kind of messes some people up is like, hey, where should we start, right? What is appropriate for me? And a lot of people, if you don't have a background in biomechanics or movement, it's hard for you to understand that. So, there are some options. Like I would say, if it's a chronic thing, just work with a professional, like a one-on-one coach. What we like to do with our lower back pain people or pain management people, usually it's like they have chronic pain, but they're still active and they're just trying to get it a little bit better and so that they can get stronger. So what we always start out with is a movement assessment. We will assess how strong their core is, how well their hips move, and then take an audit of what their workout routine looks like. And with that information, we basically just create a custom strength routine, mobility routine, and therapeutic exercise routine. And then we modify it week by week, right? Because as you know, the healing process is never linear, just like weight loss, right? There are going to be days where you feel really good, days where you feel all right, and then days where the pain comes back. But that doesn't mean you've regressed to step zero, right? It just means you have to manage it in that moment due to outside variables, and then you'll be going back in the right direction again. It's just a way to manage flare-ups, and having a coach that's experienced with that kind of stuff is super important in this day and age. And there's not a lot of people with that experience. I mean, we have our kinesiology degree, we've worked in physical therapy clinics, and we've helped at this point like hundreds of people with lower back pain. So if you guys are looking for some guidance on that, link in the description or on our website for one-on-one coaching. But yeah, that's kind of the biggest thing. I mean, when it comes to back pain, focusing on mobility, strength, solid habits, routines, getting out there to walk, nutrition, and then proper recovery protocols, right? Get your 8 hours of sleep. Try not to drink too much alcohol. try not to do crazy shit, and you will feel better. You will inevitably get better. Like I guarantee you. Let's bust some myths, brother.
Bust him.
Okay, so if I were to tell you that I heard that deadlifts are bad for your back, what would you tell me in
Well,
return?
actually, I got sent a clip the other week of Joe Rogan was saying that exact thing.
Mm.
He was like, he literally said, he was like, deadlifts are just terrible for your back. And then
Damn,
whoever
dude.
the guest was like, yeah, dude, you're so right. Like, you're so right. Oh, I think it was a football player. Crap, I'm blanking on his name. He's the guy who has CTE and
Oh, Antonio Brown? Yeah.
yeah. Have you seen that clip? You know what I'm talking about?
No, I haven't seen the clip.
Oh, okay. Okay, no, it's just BS. It's stupid. Yeah, they're bad for your back if you do them wrong or terribly, or they're dude, they strengthen your back. They strengthen it. Like,
Yeah.
come on,
And
guys.
and your glutes and your
Don't be
glutes and
afraid
your
of it.
hamstring. Yeah.
Yes, don't. It's like the king of lower body exercises. Yeah, deadlifts are great. No, don't be afraid of deadlifts. Come on.
Yeah.
It's like
I
okay,
think
well, okay, then never pick up groceries from the ground again.
yeah. 100%. Yeah, it's that's such a bad myth, and yeah, it basically it makes people afraid of certain exercises or certain movements, and that also goes into the next one where it's like you should always keep a neutral spine. This is something I've been guilty of. Like when I first started working in a
Yeah.
physical therapy clinic, we had a lot of lower back patients, obviously, and like the first thing we teach them because they are in pain is how to hip hinge. And what we would say is, okay, always keep a neutral spine because that means you're engaging your core and your glutes, and then you're not exposing your spine to crazy degrees of range of motion, which at that point in their healing journey was painful for them, right? But what you have to understand that like that's only a moment in time. Sure, some people need to keep a neutral spine, and obviously everyone should learn how to hinge, but that's only when maybe you just threw out your back or you're having a lot of pain, right? A lot of people should be focusing on flexing their back and extending and rotating and laterally bending. Again, like movement is medicine. And if you're advanced and can express movement in all planes and all ranges of motions, then your chances of getting injured goes down. So neutral spine, yeah, sometimes, but it's not necessary for always. What's our next one here?
If your back hurts, you should do nothing and rest it until it feels 100% again. That's a what would I say? I said that's an annoying one because I've had like clients go to like whoever like their doctor, like a chiropractor and stuff, and they're like, "Oh yeah, like they told me to not work out for like a month."
Yeah.
I'm just like,
Or never or
"Damn."
never to
Like
squat again or something.
yeah, dude. Oh, you did that and it hurt, so never do it again. And that one just annoys me. It just annoys me. So this whole podcast we've been saying that movement is medicine. Expose yourself to a variety of exercises that can strengthen your core, your glutes, your spine, and stuff like that. But you and I aren't saying if your back is hurt, go right like full throttle the next day and like deadlift the same amount of weight that you did the day that you threw it out or whatever. It's like no, like do a lot less load. Go for a walk. You can do exercises that don't directly load your spine. You can do split squats. There's plenty of other things to do. Don't work through the pain. Work around the pain and slowly heal yourself up. So I just think that that's crazy when I hear that like, oh, my back hurts, so I'm just not going to work out for like a month.
Yeah. Yeah, you gotta keep moving. That's the biggest
Keep it
thing.
moving.
Keep it moving, brother. And then this other one is this one I feel like I explain a lot. If your MRI shows a herniation or degeneration, it means you're absolutely screwed or fucked. And that is absolutely false, right? And I've even had a lot of clients who come to work with me with disc degeneration syndrome or
Yeah.
disease or whatever the pathology is, and they're super scared to move or deadlift or anything like that. And after a couple weeks, it's night and day, right? And that's all through movement optimism, getting them to move. And there's even like studies on this, right? A major 2014 review basically like concluded that signs of degeneration are present in very high percentages of healthy people with no problem at all. Many imaging-based degenerative features are likely part of normal aging and unassociated with pain, right? Like we said, pain is kind of abstract and there's so many variables involved, and sometimes it's not structural at all, right? And even in this study was like, I think they had a pretty big sample size, and 37% of the 20-year-olds in the sample side said to have had disc degeneration after the CT scan or MRI, 80% of 50-year-olds, and basically almost 100%, 96% of 80-year-olds had the disc degeneration, and same with the disc bulging, right? So it turns out that bulging discs or degenerating discs are just a normal part of aging, and sometimes that structural thing in the MRI or the CT scan won't reflect your performance or your pain or how you move throughout the day. So you are not your MRI, and you're not screwed. So yeah, I hope that was a good kind of primer on life-proofing your lower back. A lot of things
For life.
involved for life. Oh, sorry. Life-proofing your lower back for life. I feel like for me, this is like super interesting, doing some research on this, learning about the nutritional component, because obviously like I'm very adept in the movement stuff, recovery stuff, habits, mindset stuff, but because I'm not like a registered dietitian, I don't look at it through the lens of nutrition. And you not, I mean, at least for me, right? A lot of times when I'm working with folks, like nutrition is more of like a body composition thing. So it's cool, like, reading about all the ways. And I've known this stuff, but it's just getting that re-education. So like, just crushing some berries and getting those omegas and drinking your dairy, taking your vitamin D, which I forgot to take today, so I'm gonna hit that. Did you learn anything?
It's in my the vitamin D.
For multivitamins for men for life.
Yes. Let me think. What did I just think I said this early on, but I think the mindset part is like just totally underrated. And going along with the MRI that you just talked about, it's because it's a diagnosis, and when people have this diagnosis, they're like, oh, I have this. Therefore,
like identity. It's like a new identity.
Exactly. Yes.
Yeah.
Therefore, I'm screwed or whatever, input whatever, or I can't work out because I have this diagnosis. Exactly what you said. It's like an identity thing. And so that goes into the whole mindset thing of like, you are not your MRI, like, you know what I mean? It's so much more, think positively when it comes to that
like
stuff.
you're like a dad or you're a mom. Yeah, you're a best friend. You're someone that stays active, right? You're not an injury or you're not an injured person.
Yeah.
So 100%, man.
So I'm glad that you brought that up.
Yeah. It's always good to learn, man. Learn, and always a student of life.
True.
Before we send it off, we'll do our miscellaneous section. What's going on? Miscellaneous, books, music, life, challenges. What's on your ticker today?
Dude, I am excited for this weekend. We're gonna go golfing on Sunday, and supposedly it's like a nice course. It's like a nice course, nice. Sand Canyon Country Club or something. So I'm excited. I've never been there, so I'm excited to golf. Yeah. Speaking of low back pain, I'm feeling great. So golf should be great.
Okay, good. Thought you were gonna be like, speaking of low back pain.
I'm good. Yeah, no, I'm good. What else? Books. I'm reading a lot of like business books lately. Audiobooks. I usually read a book, whether it be on Kindle or physical, and then I do an audiobook. But audiobooks, lately have just kind of chilled out on for the past like couple weeks, and I've just been listening to like sports podcasts and stuff because the Giants are back. It's baseball season.
Nice.
You got the Warriors in their playoff push, so I'm doing a lot of like sports podcasts, and it's kind of nice, like because usually the audiobooks I'm just like intensely learning and stuff. So
Yeah.
sometimes it's nice to just like I don't know, chill out a little bit and just have fun, like listening to like sports talk and stuff.
Yeah. It's just like another part of your brain that's a little less serious and a little bit more
Yeah,
fun.
yeah.
It's
Still doing the
important.
business stuff, so that still working my brain there. But yeah,
Yeah.
yep. What about you, brother?
Nice, man. Yeah, I am still reading that Tiny Experiments book. It's actually really good. It's so refreshing, like some of the advice and experiments. I've been experimenting with like new posts and trying to, you know, reframe my default mindset from goal to process, and it's helped. And I've had a lot of fun with it. I've been able to like make some new content that I'm really proud of. But also, on the challenges side, the biggest thing is like, sometimes I work really hard with content and just work, and then, I'll make a post and I'll post it and it just does really bad. And sometimes that's part of the cycle. Like they change the algorithm and it takes a while to adjust. And it used to happen a lot more. It used to happen like every week, and now it happens maybe every 6 months or 10 months. So all in all, it's getting better, but I'm very cognizant of the emotional reaction I have when something doesn't perform well. And I'm not going to go as far as saying that I need to change that reaction because I'm proud of that reaction because it means that I give a fuck
Hmm.
and that I care about my job and I care about helping people. So I think it's more so just like, okay, noting the reaction, taking a deep breath, and then not letting it affect me. And the way that I act on that is that I just show up the next day and I make a new post and keep going because I've been doing that for the past 5 years now, and we're here. So I'm gonna continue. And anything, yeah, coming to LA, excited to hang out with you. And yeah, so thanks for joining us, people. Quick plugs of our things. We do one-on-one coaching, specifically pain management, weight loss, fat loss, all the above. So if you need help with lower back pain, and you just heard our spiel. So if you want to go through the life proofing process for life for us with us, sign up for a free chat with me, and we'll talk over the logistics. If you want something a little bit more hands-off, we have a ton of lower back programs. We have a training around lower back pain program on the app. We have a 12-week core strengthening, lower back strengthening thing in there, and then obviously mobility for days. So that's 30 days for free. Again, links down below. That's it. Thanks for joining us. See you all on the next one.
Thank y'all.